Hi, my name is Dr. Athena Payne. I'm a chiropractor here in Fort Worth, and I wanted to make a video today to kind of give you a summary of what I do, who I am. But I often get asked the question, what does the new patient visit entail? What is included in that? And how do I get my friend, my family member, my cousin, my coworker, how do I get them in to see you? And I wanted to show you some things here that I have to make that easier for you. So first thing, my clinic's name is Salence Chiropractic Clinic, and I specialize in gentle chiropractic treatment. I do the traditional, I guess you could say popping and cracking, but I really like to be very specific with my technique, and I also like to test and retest to make sure that what I have done has worked for you. So first I want to go over this. This is what I call a referral gift packet that I give current practice members who want to share information about what we do and how maybe we can help somebody that they know. And so I'm going to show you real quick what's inside our packet. The first thing that I have in here is a little VIP gift certificate. It does have a date that the patient, the expected patient, should use this gift certificate by. It is just a little gift for me to provide to people to encourage you to come in. And also in this packet is a letter. It's my 5 guarantees, and it's a little short letter that kind of welcomes you. And also in the packet is our new patient paperwork. So therefore, when you give this to somebody that you know, you already have the patient paperwork in there, and then they can already have that filled out when they come to our office. The second thing I have is a list of all of our services. And so I want to make sure that you know, as well as other people know, all the services that we provide. And that way, you may come a couple of times and not know that we do. For example, now we do acupuncture and Chinese medicine, herbal medicine. You might not know that we provide lymphatic drainage massage. Some of the exam techniques that we provide are new, that we actually implemented towards the end of the year. So all that's on here. And then in our referral gift packet, we have some reviews that I've collected, and just to share that with them so they can see what other people have said about our office. And then I usually have a article in here as well pertaining to what's going on with them. So sometimes it may be an article if they're suffering with headaches, migraines, plantar fasciitis, hip pain, whatever it is. I'll pull an article for you so that they could see maybe a little bit of research where chiropractic has helped. So just the introductory packet that I provide. So mainly you can share your experience with them, but you can also share this information with them, and I try my best to make this easy for you so you can just give that to them. We do have a recycle program, so if, for example, you give it to someone and they've changed their mind or they want to hold off, by all means share it with someone else who you think might benefit from coming into our office. Now, what the new practice member first visit consists of, some of this has changed as well. And so I want to make sure that you all know, especially existing practice members, some of the things that we've implemented that's a little bit different. Besides going over the paperwork with you in detail and your history, I also have a couple of digital examinations that I do. I do believe in doing measurements, objective measurements, to see how you've improved, have a baseline, and be able to let you know what do we need to tweak, what do we need to change, what is your body responding to as far as the treatment. So we do have a nerve scan now where we scan the spine. We also scan the muscles right next to the spine. You can tell where most of the muscle spasms are coming from. You can also tell where the nerve tension along the spine is concentrated and located. So that helps guide me as far as your treatment. The second thing we do is a digital posture scan. The posture scan measures, for example, how much your head is rotated, or perhaps if you have a high shoulder, if you're leaning a certain way, if your pelvis is rotated. And that tells me how I need to adjust you as well. But it's always great to actually see. I've seen patients where they're like, "Whoa, I didn't know my hip was that high," or "I didn't know my head was that forward." Well, now that you know, you can see the measurements. We're going to treat you, and then we'll do a reevaluation to see how you've improved or what needs to improve. Now, if the new practice member needs an actual x-ray, we send out for that, a place not far from our clinic. And I will usually take those x-rays. I get them immediately once you've taken them. I pull them up on my computer, take certain measurements, and then when you come back for your report of findings, which would be your second visit, I'll go over all of that, all the scans, your medical history, anything else that I have looked at, anything else that I've examined. I will go over all of that with you on your second visit. Now, the second question I usually get asked is, do you treat on the first visit? Well, if you come in here and you're in a lot of pain, and I just have to weigh it out, because sometimes, it's hard to treat if you don't know where you're treating yet. So I like to study my examination, and that way come up with a thorough treatment plan for you. Now, we do have different types of therapies to help reduce inflammation, to help reduce some of the pain and help reduce some of the spasm, and we usually do that on the first visit as well. Now, the second visit is the report of findings, as I previously mentioned, and so I go over your customized care plan. I also go over your care instructions in detail, and all that is written out. Any results from any of your scans or x-rays, I write those all out for you, so you don't have to remember all that stuff. And that way you can show that maybe to your wife or your husband. This is what Dr. Payne found, and this is what she's going to work on. The second thing that I write down are the goals. For example, if you have a head weight of 15 pounds and it should be 10 pounds because maybe your head's going forward too much. So I would write down goals like that. If your feet are pronating to so many degrees, then we need to reduce that. So I'll write down that specific reduction that we need to do. And then you will have your full first treatment. The first visit on the first day usually lasts about 45 minutes to an hour. The second treatment usually lasts about 30 minutes, give or take. It just depends on how much I have to go over with you guys. But we really try to make sure that we're very specific, and that we're establishing a rapport with you and listening to everything as far as your complaints and your concerns regarding your health. And so that's basically what I wanted to go over. The referral gift packet, I have that for you. And then also attached to this video, you'll see the new practice member picture. You can share this with whomever you like, but it goes over everything I just went over for you, and that's also included in your referral gift packet. So if you know someone who perhaps is suffering, no matter who they are, it could be somebody you meet in the line at the grocery store. You notice they're limping. By all means, have them call our office. The number is 817-731-4848. Call our office, make an appointment. You can go on our website, saletsclinic.com, and also make an appointment. Thank you so much.